Clinician, advocate, teacher, national examiner, magician, and a lifelong learner. With over 25 years of medical experience, Dr. Harry has cared for thousands of babies with irritability and persistent crying. He has developed the Sounds of Silence settling program, as well as authoring the popular Simple Secrets for Settling Babies pamphlet. So his topic today of settling strategies for a crying baby, I think, fits perfectly into his expertise. So please welcome Dr. Harry Zehnwirth.
This is the graveyard shift in which you're all buggered and you want to go home. You're thinking, what are we going to do straight after this? We're going to go to the pub or go straight back to our hometown. So I just want to wake you all up, and so you all need to stand up. Sorry. Gotta get the blood circulating. Okay, and I want you to all lift your arms straight above your head. That's right. Yeah, that's good. The police are behind you. Thank you for doing that. You've just been arrested. No. So arms up. Now try and lift yourselves up on your tippy toes if you can. If you can't, don't worry. And I want you to focus completely on your bodies, on your posture. Just on your posture, nothing else. Consider your body, your posture. And now come down, flat foot, and now on your heels if you can. It's a neurological exercise actually.
You're right.
It's not easy. On your heels. And fully focused on your body. So your posture. Your posture. And now let go. And now you can go to sleep. Okay. I do want to keep you a little bit active and wakeful, so I'm going to just... Peter mentioned that I do a bit of magic, and that's true. I started doing magic in my practice about 11 years ago, and it came on very naturally. It wasn't a deliberate decision, and it just seemed to happen. I've always been interested in magic since I was only 7 years old, and I sort of 15 years ago, 12, 15 years ago, I became more and more interested. And it's, you know, it's shown to be a really useful tool in practice, establishing rapport, transcending fear, guilt, making diagnoses of kids. I can quite easily make a diagnosis of childhood autism because the children I childhood autism often don't like my magic. They don't like the magic, they've almost certainly got childhood autism. The reason, I'm not making a judgment of them, it's just that if they don't like magic, the reason is that they like to think in concrete, straight lines, and if it doesn't make any sense, they say, I don't want to see another one of those. And that generally makes a diagnosis plus a few other things. So here's a $5 note, and I'll give it to anyone who wants it to just examine it. Who wants to examine it, who doesn't work here. Adam, and make sure it's real. It's not counterfeit, it's not fake.
No, it feels real.
It's a $5 note. You can take it to the bank and get whatever you need with it. It definitely is a $5 note, and there's absolutely no magic here whatsoever. All right? Now, I do this in my own practice, and it's great because I don't make all that much dough in my practice. You think, but you're wrong. Anyway, but here's the $5 note, Adam. You saw it. There's nothing else in my hand. I roll up my sleeves. Nothing magic yet. I'll give you a bit more light if you like. We just do a bit of origami method. So again, nothing special, nothing unusual. A bit more origami. A couple of deep breaths to make it happen. And then for some reason, we're able to make a bit of money with it. The mind is gone. Now, a lot lot of the kids do exactly what Adam does, and they put it in their pocket and say, thanks very much. But the thing is, I say to them, well, if you give it back, I'll make it into a 50, a 100, so they're ready for that. So they're very happy to give it back. And again, it's only a 20, it's a real 20. Hasn't been a 5 that's been transformed. And I do try and make it as a 50 for them, I make them happy. I like making kids happy. I like seeing them walk out laughing, and they do, honestly. Don't they, Lisa? They walk out, and that's one of my great missions, is to have kids happier, and parents happier, when they walk out. Reassured, more comfortable, uplifted, informed. You know, Adam, this doesn't always work, and sometimes we're too greedy. Unfortunately, it's gone back to the original $5 note. Having said that, you want to see that table disappear. Okay, now you need to really focus on this. Those that can really focus, and I hope you've all taken your Ritalin this morning, that will help you focus on this. If you focus well enough, you'll see the table disappear and reappear instantly. Instantly. So you've got to be fully focused. If you're thinking about what you're doing tonight, or your boyfriend, or the studies you need to do, or the kids, and they're waiting for it, it won't work. It's going to be 100% focused on this table. Are you ready? Yeah. And you said it. You want to see it again. You guys weren't focused. You missed it. But wait, there's more. Because there's nothing in my hands, is there? Do you believe in parallel universes? Is that 20? Parents do after a while. I don't do too much magic. Some say I might do a little bit too much, but parents do ask me, why do you do so much magic in your practice? So that's what you pay the gap for. They say, all right, cut down on the magic. Just one more and then we'll get into our talk. Just a red scarf, nothing special about it. So we just pop it in here. There's no magic. It's all very straightforward. It's definitely in there, isn't it? You can see it from the back. Red scarf. Organised this wonderful event with Lindsay. I know both of them, and I thank them very much. This is a fantastic turnout, and I think it's fantastic for you guys to last the distance and learn so much and take great notes, and I hope that you go away learning more. But it's terrific to see such a great audience learning and expanding your horizons, because it's great for the children and the families. You see any knowledge, any information is terrific. So it's a credit for you to take the first Saturday and pay money. So really a credit to the organisers. No, I understand Peter and Lindsay and there may have been others as well involved. But Peter does have special powers as well. And I'll just show you Amanda, because that red scarf is actually probably somewhere on his body as we speak. Now, just check this out. Now, listen. You hear that? It came out of his ear. It didn't hurt.